Nikki. I'm going to hand over straight to Brice so that we can make up some time and so that we have plenty of time for discussion later. I think that Nikki's presentation, her slides are going to be put online. Is that right, Kevin?
Yeah, that's right, on the ODI website.
Okay, so you can look at those on the ODI website, especially those of you who missed the first part of the presentation. Right, let me hand over to Brice from MSF.
How do you start the slideshow?
Yeah, sorry, I can't help you there.
Yeah?
From beginning.
From okay, sorry. Yeah, thank you.
Well done.
Yes. Yeah. First of all, I'm going to try to present very shortly Afghanistan and Pakistan, both in the light of more politicization of aid and what is at stake and what is influencing the so-called humanitarian space. I'm going to try to resume that quickly. Also, excuse me for my language skill. You massacre my name, but I may be going to massacre a bit your language. If there is anything, please ask, and I will try to repeat it. We don't trust that. That's a sentence actually that was put it in by one patient in MSF facility in Lower Dir. Lower Dir is a district in Pakistan, touching the Fatah in Khyber Pakhtunkhwa. And what he was saying basically is that American is paying the people who are fighting against us and destroying our homes, and then they are giving us the relief. We don't trust that. I mean, the thing is, what I'm going also to illustrate is actually what is at stake is mostly the perception of aid, not so much how the aid is delivered in impartial way, yes or no, but that the perception is very important at the core of what is the business of aid, we can say so, in Afghanistan and Pakistan. Maybe to start first, I'm not going to be extensive in the context analysis and so on, but it's very important to understand and to define the context in both countries. Meaning that for Pakistan, we are definitely talking about a conflict zone in Pakistan. Just to remember, we have a conflict in Baluchistan that we don't hear many of very often, but is definitely there. We have the drones attack in north-south Waziristan by the American army. We have the whole Fatah, but also Swat Valley and Lower Dir actually that were on constant almost military intervention by the Pakistani army. And we have also the Kashmir, of course. Then, I mean, that's very important to find. For MSF, definitely Pakistan is not everywhere, not all the provinces are under conflict kind of setup, but most of Baluchistan, definitely Khyber Pakhtunkhwa and Kashmir. And you could argue about Punjab also. Afghanistan. This map comes from the CENTCOM, American CENTCOM in 2003. That was the Taliban influence in 2003. This is today. This more or less, everybody is more or less agree of the influence of the Taliban in the country. We consider for MSF that we do have access to 20% of the territory of Afghanistan and 80% is out of reach because security concern. Now, what MSF has been trying to do in both contexts, but maybe let's start with Pakistan. We have been working in Pakistan for a very long time, but really tackling the Pakistani context starts somewhere just before the earthquake, actually, in 2005. In 2006, we start to open projects in Khyber Pakhtunkhwa in Malakand, a district. Basically supporting an hospital of Malakand and starting also some projects in Swat Valley, mainly a system of ambulances going to the front line to pick up the patient and to have access to the conflict zones. It was obviously very challenging from the beginning in Pakistan in this area. Why? So because the trust of the community about NGO is very, very weak. It has many reasons, but one of them, this region has been on the constant, has been constantly supported by NGO the last 30 years, because the Afghan context has been seen a lot of different NGO, and actually the trust on the name of non-governmental organization we discovered was very weak. Mostly what the population was telling us, that for them NGO are faith-based, corrupt, inefficient, and they promise things but nothing happen at the end. Then it was very challenging for us actually to try to redefine ourselves, to really try to explain to the community what we were and what we were going to do and try to help them. And actually, in Pakistan, we define ourselves as Independent Medical Humanitarian Association, somehow to oppose to NGO identity. I'm sure that will be a lot of questions on that, but that help also. It was also an internal exercise also to really say, okay, we discuss about independence, impartiality, neutrality, but what does it mean concretely, and how can we explain that really in terms of actions to the community? Another important factor definitely is for both countries, for Pakistan and Afghanistan, MSF use only what we call proper fund, meaning funding that's come from individuals to MSF. And we publicized very proactively. We did the publicity of it, saying, look, we have no funding from any government. We have totally independent in terms of funding. And actually, we were quite surprised that many community members, that was basically the very first question they asked. I can remember an example in 2009, in May 2009, during this huge displacement of people from the Swat Valley in Malakand district. It was the very first question they asked. I mean, okay, you are coming to help us, but where is your funding coming from? Who is financing you, and so on? That was really something important. Progressively, we increased our visibility. In the first place, in Pakistan, we were very low profile, to the contrary to Afghanistan. I'm going to explain, because Afghanistan MSF was very well known for the last 30 years, not in Pakistan so much. In the beginning, because all this distrust and this lack of trust, we start in very low profile kind of way, and step by step we increase our profile till today, where we are working fully identified with white cars, MSF stickers, everything, the full gear. Also, we insist very much on presence of international staff. Why so? Because again, in a conflict zone, they are the only ones that are able to leave very quickly. If there is anything going on, your national senior staff will have to bear most of the political pressure, will have to take all the pressure from the conflict and everything. And we say, no, if we open a project, we want to have international staff to be able to take that pressure. Also, to be able to guarantee the delivery of a quality healthcare. That was also an issue, the quality of the projects, of course. Also, we concentrate on high-value activities, life-saving. For instance, we did not invest much on primary healthcare, but mostly on emergency room, referral systems, really to be able to take the patients, the wounded, the pregnant women, and to bring them back to the referral system, to the district hospital. Non-weapon policy, that was also something very difficult to apply, and we are still doing some compromise, not in Afghanistan, but in Pakistan, yes, because we are not supporting the entire hospital, but part of it, meaning that you have what you call the levy. It is the tribal kind of army, who are still at the front gate. But in some case, we succeed to change the weapon against a metal detector. Still is an issue in some place. In Hangu, we succeed to completely remove all the weapons from the hospital, but we had the side effect that then the authority insists that we were in charge of the security inside the hospital, and we had to put a full metal detectors and everything of the full security inside the structure. And they oblige us to put some preventive security measures that we were not very keen to put, but we compromised. No arm escort also is something we try very much. It works pretty well in Malakand district, in Swat, in Lower Dir, in Angu as well, but in Baluchistan we did not succeed to do so. I mean, it was just a complete refusal from the authorities, saying, okay, if you want to implement any project, you will have to be with armed escort, because we are in charge of your safety. And this is still a big debate inside MSF, because obviously this is a conflict where, I mean, the Pakistani army is directly involved. But so far we succeed to explain to the Baloch resistance and to the population why we are doing it, and we have no other choices, and they have understood so far. Very active networking with all actors. I think it was also very important to, and the float intervention in Pakistan illustrate that very much, to really to ask to the teams at the project level to really be focused on their political environment, to really be able to go to see all the community leaders. It seems obvious, of course, but we almost push also to say, look, the first priority is not to coordinate with other NGO, it's not to coordinate with UN, it's not to coordinate with the government. The first priority is to coordinate with the communities, with the people that matter at the district level, basically. And of course, we are doing also coordination with the other actors, but really to be able to shift and to put the focus on what was really necessary. That's today more or less what MSF Change a little bit is doing in Pakistan. Just wanted to explain the location where we don't have access and is still an issue is definitely the whole FATA region. I mean, this goes almost, it's like almost normal today, but FATA region is a conflict zone where we have almost no access today. Even location like Tank and Dera Ismail Khan is a year and a half we tried to have access, but Pakistani army have refused completely. We have done a lot of lobby with ambassador, with the army itself and everything. They say, we know you, MSF and so on, but for Tank and Dera Ismail Khan is no way. We agree that you go with national staff, but not with expatriates. And that was a condition we are not ready to say, okay, no, that's impossible. We want to reach the place with international staff. And the whole FATA, of course, which is, yeah, has been always a difficult place to reach, of course, but definitely today is still something that's a bit completely out of the radar of most of the organization. That's really still a location where we don't have access. Then, I mean, the politicization of aid. Basically, for MSF, we were very surprised how the whole emergency intervention was sold to here in Europe and US. We were not surprised that the government were saying that they have interest to invest in Pakistan for the sake of the internal security, but I think it was one of the first time that was put at the very forefront. It was the first thing, was not actually the needs of the people, but it was just, okay, it's interest for the security of London Street to basically intervene in Pakistan. We are very surprised by this level of be so cynical somehow, and it did have an impact on the field, of course. I mean, how can you, when you negotiate with the different actors, when you are with your community and the community see in the press and everything that basically you are there just because you're interested in your own country, is a very difficult, concretely to tackle for the team on the field. And I mean, MSF did a press release attacking directly also some statements that were done by United States, but also by UK, expressing that view, saying, okay, look, we need to invest in Pakistan for security reasons. Actually, if you look at it, it's quite strange in the sense that the very meaning and understanding of humanitarian was fundamentally, perhaps irrevocably compromised. Whereas in conflicts such as Kosovo, military intervention was justified on the humanitarian grounds. It's true, if you remember Kosovo, say, okay, this is a humanitarian war. And Pakistan was the opposite, actually. We saw the inverse trend. The humanitarian response is being justified on security grounds. I mean, just to show that one way or the other, the politics are using it. Yeah, just you know all those sentences that are quite famous now, the famous force multipliers, parts of the combat team, element of soft power, that was not so long ago, a year ago, from Rasmussen, the head of NATO, saying that NGO were the soft power of and the hard power to oppose it. We also denounce that very strongly, because again, this is just amazing when you are on the field in the conflict area to listen to those kind of statements. Of course, This is quite obvious. Yeah, again, just on the politicization of aid also from the Pakistani army, because as I show you, we don't have access in many places in Pakistan, because basically we in the NGO community, we are following a bit the Pakistani army green light. I mean, the Pakistani army intervene somewhere, they say the area is clear, and then you can come and you can intervene. We succeed to be before them in some cases, but now it's becoming more and more difficult really to enter in some area where Waziristan is obviously a very strong case where it's totally obvious. They completely forbidden the access. The challenge of multiple mandates. Actually, when we discuss about this debate, mostly we refer about the politician and the military people trying to use humanitarian agenda, or trying to use the humanitarian umbrella to justify the intervention and everything. But actually, what we are finding more and more in Afghanistan, definitely, but also in Pakistan, is the problem with the multi-mandate international organization, where you have an organization, and again, it comes with the definition of the context. I mean, in non-conflict zone is absolutely no problem, but in conflict zone, to have the mandate to do longer-term development projects, doing capacity building of the state, trying to deploy very valuable services that are actually completely challenged and attacked by the other side, is obviously, but you close access to one part of the victims, and that's a fundamental issue that we were quite amazed in 2008 when MSF started to return in Afghanistan, to see that most of the people were defining the context as post-conflict. You could go to NGO with big wire in Kabul, 5 meters high walls, and they say, no, we are in post-conflict, it's no problem. Then we are a bit surprised and say, this doesn't look like post-conflict. When was the last time you were able to go to see your project yourself? 2005, maybe, in the south, never, almost. And a quite long time ago, then, I mean, we were completely astonished by that. And then it shifts now. I think now most of the people, most of the organization recognize that it's not a post-conflict setup anymore. This is a full-gear conflict kind of context. But still, you still have organization using both hats, saying, I'm supporting the government and I'm deploying services for the government to help the people for a very good action. And on the other hand, I'm capable to do impartial, neutral action, where I can discuss with the opposition. I mean, how can you do both? I mean, we challenge that very much. We have been discussing, starting a discussion with an organization like Oxfam and others to see. I mean, there is a controversy there. I mean, where I think for RCRC is the same. We are, it's true, at the far end of the scope of organization, but okay, still, in this kind of conflict like Afghanistan, is quite obvious for us. Right? Yeah, I need to speed up. Yeah, I can feel that. Yeah. Rapidly, Lashkargah Helmand, MSF, we start a project in Lashkargah Helmand in 2009, and actually, I just wanted to change a bit this very abstract concept of humanitarian space, in the sense that this humanitarian space doesn't exist in itself. It's not something where you arrive. I have the humanitarian space here. It's really something. What we found in Helmand is a very classical conflict, totally classical conflict, with few actors that are very well identified. You have the U.S. Army, the British Army, NATO forces, because you have few people also working also in Helmand. You have the 4 or 5 families that are running the show of the puppies business. You have the Taliban, you have the Afghan army, and the Afghan government. Then very well identified actors. And actually, we start negotiation with all of them, and we increase our own space. It took us 9 months at least. It was quite long and difficult, but still I was quite amazed that again, something that we know for the last 200 years, but in a conflict area, there is a need for a neutral actor, definitely. And the population didn't have access to anything anymore. You could see on paper like you had something like 25 health posts in Helmand. If maybe 10% of it is working, is wonderful. I think maybe 5%. The rest is just empty box where nobody went. Just data are coming, but they are completely fake, mostly. And just the population has absolutely no access to any kind of health care. And definitely the need for a neutral actor that is talking to both parties, doesn't have any political agenda, doesn't support any sides, and are dealing with both sides in the same way, in a very transparent way. Like when we negotiate with the Taliban, we explain what we negotiate with the US Army and the British, and the opposite. To be really being, I can tell you everything we negotiate. It's nothing secret. It's just to negotiate that the hospital is safe, and then you have no weapon inside, and everybody can have access to the hospital. It's very simple, actually. Simple, the discussion inside. To arrive to that is not simple at all. But no, and it's no guarantee that we will not be targeted in terms of security and so on, of course. But at least you can try to work and to increase this space yourself. That's why when we hear that humanitarian space is decreasing in Afghanistan, actually, is the space of the NGO that are supporting the government, of course. Of course, this space is decreasing. I mean, as I show you, 80% of the, maybe 95% of the country now is more or less under the influence of the Taliban in a way or another. Then you can still broker some local deals, obviously, but still you have some centralized opposition that will you need to negotiate with. Otherwise, they will not let you go and will not let you to have access to the victims, to the whole population. That's the big challenge. I just wanted to finish with this. This has been taken from the article of Jonathan Wiesel in the HPN articles, and it resumes quite well for me the challenge the humanitarian community is facing today. I'll let you read it. I will not read it myself.
Thanks very much, Brice.